Ladies and gentlemen, good morning. We like to start the joint meeting. Please, everyone, if you have your things on, except the chair and the chairs. When I mean chairs, I mean Joyce and Debbie. Please keep your microphones on. Good morning, everyone. Welcome to another joint meeting of the Brooklyn Family Support Service Advisory Council and the Brooklyn Developmental Disabilities Council. Welcome, everyone. Before we start anything, you know that we always supposed to start at 9:55, but we're doing right now, just want to remind everyone, housekeeping rules. Right now, except the two chairs, everyone else should be on mute. That's on your phone, computer, or tablet. Please remind yourselves, if you have a question, please click on the Mantle panel and raise your hand. Or if you want to type it in, please put it in the chat. The questions will only go to the host at this time. So please make sure to put that in. As a reminder, everyone, if you're on the phones today, mute buttons are available on the phone as *6 to mute or unmute. Again, *6 is to mute or unmute. Phone, if you're going to have a question, raise your hand is *9 to raise your hand. Please always have that ready as well. *9 is to raise your hand for the phone people. So please make sure that you all are set up. This hand will go around spinning and reminding you to please make sure you please do that. Now, I remind everyone, anyone who has a question on the chat, please, if you have an announcement, please put that in the chat. If you have a question, please put the word question on the chat. The chats and announcements will all go to the host to make sure to keep questions and everything run properly and keep the meeting on schedule as well. So please make sure everyone, please follow these instructions and we can always work together. Now, before we do our regular review before we do anything, Joyce and Debbie, I just need you both right here 1 second. Joyce, I know you're on mute. Due to the fact that because of very busy times right now, as you know, we are really busy with getting other things ready. The regular minutes were not ready this month, and the only minutes are ready, which Debbie and Joyce will agree, is the recording minutes, which is available on the website. The only thing I'm asking is I need a motion to waive the typing up minutes.
I make the motion to waive the typed up minutes. Joyce, do you second it?
I second.
Okay.
Thank you.
And it's one important thing, please, everyone. Share that meeting video from Diane Bergiulio, a reference to Willowbrook, the history. It is very important, especially we're in legislative season right now, where the legislators, because of the budget, please share it with them. It's extremely important. And also we need to educate everyone, that includes the press and anybody you can think of, so that they understand why we advocate the way we do. It is so important. Thank you.
Now, before we introduce, as you know, due to the coronavirus, we did lose some people. Some of them may have coronavirus. We'll ask you to please have a few minutes of silence for them. Thank you.
Thank you, everyone.
And now I'm just gonna now do the welcome to our meeting. Joyce, you want to introduce Winnie, or you want me to continue?
Oh, you can continue, Chris. Thanks.
Okay. I'm checking with both chairs.
Both chairs, that's fine, but
That's okay.
Yeah.
I have some excellent news for everybody. I just have excellent news for everyone to know. Thankfully, the governor and our Commissioner Kasner heard what we were saying. So now families who live at home, children of the families who live at home who receive family support services, their children can go to get the vaccine. Also, their parents could, and also the workers. And that also includes Special Olympic coaches and athletes.
Okay.
So I think that's a good news. Look for sites through the Advisory Council's website.
Or other things. Okay, let me move on to our meeting as we welcome everyone. Now I'm going to introduce Winnie. Are you there? Because I know you're here.
Hi, guys.
Ah, here she is.
Hi, Winnie.
Winnie is today not just our speaker, but she's always has some really good stuff from IEC.
Or
And-
bad stuff. Go ahead,
Yeah.
I'm sorry.
But see,
It can be.
hey, you got good music, because look how popular you are, just like I did this time. You didn't miss anything. So Winnie is going to give us some, I hope there's some good news, some funny news, some serious news, and yes, some bad news. But we want to make sure that, everyone to please write down your information, that if you have any questions for Winnie, please put on the chat, as well as have a chance to, and Winnie, this time put you near the Blossom this time, to keep the love and peace moment here. So,
Okay.
I'd like to introduce Winnie Shit from IEC. If I mention whole titles, we'll be here till next year.
Thank you, Chris.
No problem.
Yeah, so the Interagency Council of Developmental Disabilities is doing our lobby days this year with 4 other associations, and we usually do that, and that's CP of New York State, and Developmental Disabilities Alliance of Western New York, NIAMP, which is mostly downstate, multicultural providers, and the Alliance of Long Island Agencies. And we're actually in the middle of our lobby days right now. So we've prepared a white paper on the budget, and that's what I'm going to go over with you. It's not going to contain every single little thing that the governor has proposed, but it's going to focus on what's most important for us to advocate for. So I think that's the most important stuff for you all to know. And I will forward our position paper to you, Chris, so that you can send it out to everybody later. What we noticed as we looked at the entire governor's budget, and for the past 10 years, is that there's really a theme of inequity and injustice, that we have for 10 whole years received a lot of nothing but cuts here and there, and all the cuts are sort of couched in, oh, it's just a couple dollars here and there. But every time, because we're funded through Medicaid, every time the state cuts $1 to our services, it almost always results in a $2 or more cut to programs and services for us. So it's just, like death by 1,000 cuts, and we've pulled it all together in this paper, and we're going to present it like that. That there's just a problem with equity and justice for us. And I want to say that we're already getting some good traction there. We have really good friends in the legislature, so all of your work to make sure that they understand why we need services and why funding is important has really done a lot for all of us collective in all of New York State, and thank you. So, like I said, for 10 years, we got no COLA and various little cuts here and there. And when the pandemic hit us, we were already in a pretty precarious financial position, provider-wise. There were 37% of providers reported losing money on OPWDD-funded services. 50%, a whole half of providers in New York State had less than 40 days of cash on hand, so that if payments were late, there wouldn't be any salaries paid in 40 days. And 33% had less than 30 days. And that has gotten way, way worse since the pandemic has hit us. Deborah and Chris were talking a little bit about vaccines becoming available and the governor hearing us, and yes, that's true. As of February 15th, everybody with a developmental disability and lots of other comorbidities, so I'm in that group too, I'm very happy to say, although I did get COVID, so you can't be careful enough, guys, and it was, pretty recent, actually. And I'm only throwing that in because I don't go out, I don't see anybody, I always wear a mask, and somehow I got sick anyway, so just don't take it for granted. Anyway, as of, and these are OPWDD's numbers, as of February 10th, 12,414 staff have gotten sick. 9,267 people with IDD have gotten sick, and 618 of those people have died. So that's a 6.7% fatality rate, and that's way higher than the general population, which is why we were given, 1B status to get the vaccine on February 15th. From March 1st through October 31st, and that's just the period that we surveyed providers, not-for-profit providers incurred $130.8 million in additional payroll costs because our staff had to get overtime and hazard pay for working with sick people, and basically in hospital type settings when people were released from the hospital but still contagious. We had to pay $20.7 million for PPEs that were so impossible to come by. I know I've said these things to you before, but not with the dollars attached. At one point, an N95 mask was $5, for one. And we had to pay it because we needed to protect our staff and the people in our programs. So that was huge. And we also had to close programs, and we lost $327 million just in regular revenue losses. And we had to keep all our staff on. We had to pay all of the rents and mortgages on our buildings in order to maintain programs. So all that together is $513.3 million, and we didn't get a penny of that reimbursed. So we were in a bad spot before COVID hit, and it took $513.3 million away, and that's only up till October 31st. And that's where we are right now, or actually worse, because obviously the pandemic is continuing. Then in May, they announced these cuts to residential programs, cuts to providers who have people living with them who are more frequently hospitalized, or for people who visit their families on the weekends and then take a vacation or two, as if when the person is not living in the house, or I shouldn't say living because it is their house, but when the person is not actually sleeping in the house for a night, that expenses go down. And that is absolutely not true. Particularly when somebody's in the hospital, we deploy staff to the hospital to be with the person who's hospitalized, and especially during COVID. That was actually one of our early victories, right? They weren't allowing us to be in the hospital with people who were sick. That was so crazy. And then finally they allowed one person. So this is a $230 million cut. And they're acting as though, we're not taking services away from people. We're only not spending the money when the expense isn't incurred. That's not true. And it's kind of a tricky thing to articulate because it sounds real good, like if the person's not there, they don't have the expense. But it's not true, and we've been able to say it in a way that actually rings true with legislators. They get it. So this is very, very good. The executive budget proposes cuts to us. First of all, they say that there's a 2.8% increase, but that's actually not true. In fact, there's 1.2% less money in the budget this year than there was last year, than there was proposed for last year. And there's a bunch of little cuts that are proposed to, there's actually $330 million if you add them all up, including to care coordination organizations, a 1% targeted Medicaid rate reduction, elimination of what's called the triple R, and getting us to instead get prior property approvals for repairs on residential buildings, and a 5% reduction in non-Medicaid service funding. Because of COVID, and we understood that the state was in a terrible financial position, they did a 20% withhold on state-only funded services. They've reduced that to 5%, but it's still a cut to us. And it's still not acceptable. So the bottom line is that the state is saving $117 million, but to us, it's a $330 million cut because of the federal match. And that is just a crazy thing to do. On top of that, since President Biden came into office and they've been working to move the new COVID relief package through, we were already getting a 6.2% FMAP increase. It used to be 50-50. Now we get 56.2% on the dollar. There's another FMAP increase that's just for HCBS services, and it's not allowed to supplant current funding. It's got to be on top of, and that's, I think, 7.35. So that will bring in a lot of money. And then they're talking about something like a $23 billion income for New York State, for state and local government support. The governor had been saying that he had to get $15 billion or it wasn't going to cover our expenses. The $23 billion is something like $12 billion for the state to use for whatever it needs. So he didn't get the 15, he got the 12. We'll see how that pans out. The fact is there's tons of federal support coming. So really, we should not be feeling hesitant to ask for absolutely no cuts, and that's what we're doing. So what we're telling them, and we're getting tons of support, like I said, but we need everybody to yell this, is we want the COLA. That's $26.9 million that it'll cost the state, and they're getting all this additional COVID funding, and we need it to pay for rising expenses, to give our much deserved staff raises. One of the things that's in the budget is $32 million to raise staff up to minimum wage. And of course, in New York City, we're already at $15. But in other parts of the state, the new minimum wage is $12.50. And then in other parts, they're still getting up to $15. The fact that there's money in the budget to bring our staff up to minimum wage is enough of an embarrassment in itself. It's proof in the budget that our state sees our jobs as minimum wage jobs. It's unbelievable. Living wage is what we need, and the COLA will help us just a little bit to get there. So we have our work to do, but we need that COLA. Then we're rejecting that 1% targeted Medicaid cut, and we're basically rejecting all the cuts. For our workforce, we want $25 extra million so that we can hire people to fully staff our programs. And this would come out of COVID-19 relief funds. And there's also a lot of talk about workforce development, education, and training initiatives in the governor's budget. We want to be included in all of those initiatives. We're also looking for budget transparency. So in the old days, like when my very first years in this job, and I'm doing it 13 years, there used to be like supportive IRAs and a budget number. So we could tell how much money was being allocated for each type of service, and we could figure out year to year what we were getting or not getting. Now it's just one lump of money, very unclear, and we want budget transparency. So we're saying that what we want is a scorecard, which is that kind of a line by line, how much each program gets allocated. And then we want also an accounting of year over year spending. And we want that to go to the legislature as well. There's some proposals in the budget about residential services. In addition, well, that May 1st cut thing is not in the budget, but these are. They're looking at providing the most integrated, the most for new people coming into the system for residential services, they want people to get the least restrictive kind of a residential option that they need. And that in it, you know, in theory is a perfect thing. You know, it just, we'll see how it plays out. The other thing that they're looking to do is to move some people who are currently living in state operated residences into not-for-profit residences, and then take some students who have aged out of state schools and bring them, and these are generally speaking people who need extra support, and offer them residential options in the state operated residences that where the vacancies are because the people moved out into our residences. So again, theoretically a great idea. It's all in how it works out, and people like my executive director are going to stay involved in the conversation and stay close to the way that is going to be operated. Does anybody have any questions about OPWDD or our positions, or is there something that you're concerned about that I didn't mention?
If anyone has a question, can you please raise your hand so I can see you? Joyce, do you have a question?
No, I'm pretty familiar with everything Winnie is saying.
I think Joyce has heard me a lot of times.
I know, but I still have to ask that question.
Okay.
Winnie, there is one question that I'll ask. And okay, I see someone just raised their hand. I'll with them 1 second, but let me ask this question. I know I said this late earlier, but I wanted to say it again. When you have a chance, can you show that video I did yesterday with 2020 census to Chris Trieber, because it might help the education piece.
Thank you, I will.
because this Miss Golden did a fantastic information on this, and I'm not just talking about education. I'm talking about healthcare, everything. There is a weaponry, and I just want to tell you, Roxanne Representative was on yesterday, so it is a starting point. Also, getting elected officials to welcome to the meetings as well. So we hope that this information is very well, and I'll be mentioning this later on my report.
I just wrote it down so I won't forget. Thank you, Chris.
No problem.
So for education, it's kind of the same story. We have preschools and school-age programs, and the tuition that they receive is far less than what school districts get. Sometimes they're educating similar type kids, and sometimes we're educating kids that actually have more needs for support than the school district can provide, so they send them to us and then give us less money to work with them. So our teacher salaries are really low. This has been a situation for years and years. We say it every year in the budget, and we haven't really gotten anywhere with that. So this year, we're trying something new. We first started to think, well, how much of a tuition increase would we need in order to really pay our teachers properly? And that would be so high that we would not stand any chance of success in getting it. So instead of asking for an increase at all, what we're asking for is a statewide joint public hearing in Albany, but it'll be obviously via Zoom, where parents and teachers and maybe even kids can get up and talk about their schools and how it's nearly impossible to get certified teachers, and that is really damaging to the quality of their education. And clearly it's a matter of equity. So we're looking at equity, access, and quality as sort of our big themes, and we want to get that statewide public hearing. We want a plan to be developed from the information that gets shared, and we want to make sure that that plan gets implemented. So that's our big education ask. Within that, we have a couple of asks for education that have to do with COVID expenses. One is because our schools are terribly under-enrolled, and if you ordinarily have 200 kids attending your school, and it's not about attendance, it's about enrollment, right? So it's a more of a problem for the preschools, I think. And some of it has to do with the lack of evaluation, so that kids can't move from first into early intervention, then from early intervention to preschool, and then even from preschool to school-age programs. But if you count on 200 kids to pay all your expenses like teacher salaries, but especially even rent and that kind of stuff, and then you only have 100 kids showing up, you're getting half of the cash on a daily basis to cover your expenses. So we are looking at a solution for that. And another one, which is again for the COVID-19 expenses for just reopening classrooms. So all of the air filters and cleaning supplies and PPEs and you name it that our schools need, that we also didn't get any money to cover. And we're also asking for an additional $8 million in teacher turnover prevention funding. This is a tiny little bit of money, and it's really just kind of symbolic, us hoping that they want to show us that they care by throwing $8 million for the entire state. It's about $200 per teacher for the schools that qualify, so it's not much, but we're asking for it anyway. Any question about education before I move on to health?
Winnie, Sandy Neighbor had a question for you. Sandy, go ahead.
Hi, Winnie.
Hi, Sandy.
How you doing?
Good.
What is FMAP? You said something about FMAP. I don't know what that stands for.
You know, I can't remember exactly what it stands for either, but it's like, it's the federal match to our Medicaid. I'd have to look it up to tell you. Federal Medicaid something percentage. But anyway, so in regular times.
I have assistance, federal Medicaid assistance percentage. Does that?
Oh, yes, or even program. Actually, I don't think it's percentage. Federal Medicaid assistance program.
Program, okay.
Actually, I'm not, you know what, I'll look it up while I'm telling you. But anyway, all the states have different percentages. New York State has a lower percentage than other states do. Some states they put in 20 cents and they get 80 cents for every dollar from the feds. FMAP is the abbreviation for, it is percentages, Federal Medical Assistance Percentages. So New York's percentage was 50%, and that's pretty much what we get for our programs. But during times where there's an emergency, that percentage gets bumped up. So now we're getting an additional 6.2% because of some previous COVID relief packages. And the package that's coming up is going to give us an additional 7.35, and that's going to be targeted just for HCBS, home and community-based services.
Wendy, I'm sorry to interrupt. Debbie has a question about that question you just
Okay,
said.
I'm adding, I feel we're being punished for being New York State. But the other thing is, how come they can't tap into also the Medicare portion? Because many of our individuals do have. The reason I also brought it up because when Jim Moran was working for WDD, he said he wishes he could have tapped in because that would bring so much more money in. So how come we can't?
So I don't know all the technicalities there. I will say that for health services, Medicare does cover some part of health expenses for people who are duly eligible. And I know that there's been talk over all the years of taking better advantage of Medicare, which won't cost the state anything. And but most of our services are funded through Medicaid. Most of our non-health services.
Yes, I understand that, but that would be a big help, and the programs would have more money too.
Yeah, I don't have a technical answer for you there.
Oh, I understand, but if you can tell us how we can advocate for that, I'll be very happy to do that.
Well, I'm guessing there's a reason that we can't, that Medicare will not cover long-term care services or home and community-based waiver services. There's something federal that would prevent us from tapping into Medicare for all those services that Medicaid now covers. But I don't know the law there. Okay. I'm writing it down. Thank you.
You're welcome.
Okay, so very briefly, the last couple things in the budget, there are some changes to that telehealth law that during the emergency, the governor correctly realized that telehealth would really help us get services to people in their homes. So the rules were relaxed for both the originating site, which is where the patient is, and the distance site, which is where the practitioner is. And the governor's budget makes the originating site restrictions permanently relaxed. So patients can be wherever they are and receive the services. But the governor's budget doesn't relax permanently the distance site restrictions. So clinicians will have to be in the clinic after the public health emergency is over. And we just want the distance site to also be permanently relaxed so that clinicians can be anywhere. And that would really help us because it's been so great to be able to do telehealth for everybody now. And then the last thing is that there's some language in the budget which gives administrative authority to the Department of Health to cut another $11.9 million out of early intervention. And the cuts are pretty much targeted at the provision of ABA services to babies and toddlers with autism. And that's crazy because just because of COVID, almost 11,000 fewer children are receiving early intervention services. And the children who are currently receiving some services are not receiving all of the ones on their IFSPs. And those two decreases in service provision have saved the state $78 million, which means that children are going without the services that could really change their lives in the future. And now they're looking at saving another $11.9 million. So we're just rejecting all of those cuts. And that is the entire white paper, and that's what we're fighting for.
Joyce, do you have any questions? You know, I always, Joyce, are you there?
No, yeah, no, I'm here. I'm here.
just checking.
Questions, only lots of concerns, and, you know, I just hope that we have enough friends in Albany that will come through for us and we get something out of the budget. 'Cause otherwise it's going to be very, very sad.
Yeah.
Yeah.
I'll say that, so Governor Cuomo is suffering with this nursing home scandal. The deaths in nursing homes were underreported because some of those deaths were reported as hospital deaths. While we're pretty sure that that didn't happen for us, we don't want to align ourselves in any way with the nursing home scandal because he is absolutely out of his mind upset about this. And we don't want to go there in any way. And we also don't think, we think that even if our people died in the hospital, they're being counted as, you know, OPWDD deaths. And he really did come through for us with a couple of different things. You know, one, letting us be in the hospital with people, then giving us 1A access to vaccines for people who lived in residential settings. And then, like we were talking about, that the rest of us are, I mean, a lot more of us are eligible as of February 15th. So we don't want to pick on him for that. He did the right thing. He heard us in our chair. We have new chairs in the Senate and the Assembly right now, but they're both amazing champions. One is a guy who's really new to us, but he's a dad, which is pretty amazing. And the other guy knows us extremely well, and he's also a dad. So it's all good, and we'll see what happens. But he needs some good press right now, so we're trying to capitalize on some of that opportunity, maybe. And when I say he, I mean Governor Cuomo. The legislature is very interested right now in taking away his executive order authority. He has done great things with the executive orders, but they feel that he has too much unilateral control of the way things go, and they want to stop his ability to continue these executive orders. So he's not in as great a position right now as he's been in the past. I don't know what that means for us, but it could possibly be a new angle.
Winnie, just to add that in, you know, why he did a lot of those executive orders, and this is the truth, our mayor did not follow some of the guidelines because it was disturbing a lot of complaints with people with disabilities. And he also and this came because a lot of executive orders came from, because some were counties, some of them were following the rules, some were not following the rules. Unfortunately, it was our mayor, Mayor de Blasio. And unfortunately, there is an issue going on, you know, because some of his executive order the mayor did, he actually interrupted schools, you know, and it did disturb special ed. It hurt a lot of disability and senior population. So people may be forgetting that a governor in New York State has that order. But if the other elected officials are accusing him, unless they don't have evidence, it's like it's all talk. Let's not talk about it. Let's work, like as the governor said. I'm not here to hear politics stuff. I'm here to make sure our New York is safe and protected. Yes, and he did admit it on the press conference that, yes, he made a mistake. A true elected official will make a mistake, like our former Borough President Marty Markowitz.
Everybody's human, and we all make mistakes. And I think the overall thing is that, exactly, that they were trying to do the right thing with COVID and all through. But I think I'm going to close by saying it's all politics. It doesn't matter if they say it's not. Don't forget that it always is. So.
Absolutely.
We have people raising their hands. I do want to, because I want to get them, and then I'll get to you. Dolores Kong, you had your hand up, and then Debbie's next, then Rose.
Nothing.
Dolores, you need to unmute.
Oh, I need to unmute, sorry.
Yeah, I
Okay,
got
now
you.
I'm unmute.
Yeah.
Good morning, I'm Doris Kahn from New York State Institute on Disability. A question for you, Winnie. I heard at one of the interagency council meetings, you said, you were talking about the state giving broadband width for all. Can you go over that again and tell me how it impacts on our families? Because that's a very big issue. with our families. A lot don't have internet, and it impacts on them with going to individuals who are living at home.
Yes, definitely. And I just want to say that we definitely support that proposal. I'm sorry.
I know the governor is working on that, but I didn't understand how it's going to trickle down and impact on our families. So
Okay.
if you-
So there's got to be, you have to be eligible for the program. And I don't know what the eligibility is off the top of my head, but we will find out when the regs are written. You know, I'm not sure that they've gotten to that level of specificity, but if you qualify economically for the program, you get $15 a month broadband access. And this is a statewide initiative. And then there's a grant program so that if you can't afford the $15, you might get it for free. So there's 2 tiers of eligibility, and it's all about income.
Thank
So
you.
we'll get you that information when we have it, but it is a great program and we absolutely support it. We decided this year to focus on the things that we either want or don't support, and we're leaving out the other stuff, but it is nice to be able to say that he's doing something great in that area, because he is.
Right. Yeah, you have to make your priorities. We understand.
Yeah.
But this year, it's been a priority. If you didn't have bandwidth, you were really lost.
Right, then you had nothing for school.
Nothing for school.
Right.
Be hard.
Or day program.
Oh,
Thank
yeah.
Tell me about that.
Anybody
Thank you,
else?
Doris.
Thank you, Doris.
Debbie, okay, Winnie, I heard everything you said about with the governor, and I do agree. But, you know, we could keep him on our side by also letting him know that with data from the Census Bureau and others, that when you help children early, with early intervention and preschool, and help them also in the right programs, then in the long run, it's cheaper for the state. Since he needs anything to make him feel better or work with us to help. So we can now, you know, I'm not attacking him, but I will contact him with others to say, please, we know you're going through a difficult time, but remember that also there are many other wonderful things you can do to help everybody.
Absolutely, and that comes under the category of giving them information so they can make good decisions.
Yes, and that's what
It's not
we do.
criticizing, it's helping.
Yeah.
Right, because I'm just going to let him know, because he knows a few people with developmental disabilities, and I'm going to bring up issues in writing so he can understand where we're coming from.
Absolutely.
Rose, you had a question. I'm unmuting you. Go ahead, Rose.
All right, thank you. Good morning, everyone.
Yeah, Rose, fix. I was gonna say fix.
Oh, there
Can you hear me?
Oh, we want to see you.
Can you see me now? Sorry. Good morning,
Yes.
everyone.
You're loud and clear.
So Winnie, quick question. I know you've touched base a little bit about the telehealth services. I just want to confirm for provider agencies that are providing waiver services, they have community hub. So will telehealth continue as long as we continue to be in this public health crisis, right? Because I think in one of the waiver, they had highlighted that it was going to end sometime next month. So I just want to confirm.
So, right, the telehealth that I mentioned is for health services only, and I should have said that, so thank you.
Okay.
Our ability to provide day services remotely is governed by that Appendix K of the Medicaid waiver, of the 1915C waiver. So that, to my knowledge, still does expire at the end of March, but I feel very confident that it will be extended. And I also know that OPWDD made a request to CMS to continue teleservices I think indefinitely. That was not approved yet, so we'll have to see what happens there. But there's no doubt that OPW sees the value in teleservices. And of course, we want to get people together again and back into their programs. And, you know, it's way more fun to be with friends than it is to be at home on a Zoom, but as it is for us right now. But I know that they want to continue it, and it makes perfect sense for people who are just not feeling perfect that day, or who have an appointment and can't get to program that day, or, you know, there's a million reasons why ComHab and other day services are good to be provided by telehealth. So I feel pretty confident that that's not going to be a problem. But as far as the official thing goes, right now I'm pretty sure it expires at the end of March. But I'm sure that we'll be okay, and we'll let you know.
Thank you.
Thank you.
Thank you, Rose. I have to lower my volume down because you speak loud and
No,
clear.
you also have a good mic system. No, we're glad. Thank you so much.
Sorry.
No,
That's
it's okay.
No, it's all right. Thank you very much.
I
We
think
appreciate it.
everyone heard your question very loud and clear around the borough of Brooklyn. I'll see you in a minute. Does anyone else have a question for Winnie?
Chris, can I ask a question?
Yes, Matthew.
Go right ahead.
Sorry, I couldn't figure out how to raise my hand in this.
Well, at least you asked nicely.
You're so
But-
polite. Thank you.
I wanted to ask about the Medicaid global cap. I've heard a little bit about Gustavo Rivera's bill, but I haven't seen anything here. And I know that bill's probably a long shot, but I feel like it really hits some of the core of the defunding of our programs. And I just wanted to hear your thoughts on it.
So we had argued for many years to be, or I should say some years, to be included under the global cap, and we're not. So that cap doesn't apply to us at all. Often there are savings that are generated by that global cap, and some of those savings are used to pay for our services, and that further complicates our ability to understand how much money we're getting, because sometimes the money that pays for our services is actually from Department of Health under that, from money saved under the cap that is redirected our way, and then it looks like OPW is spending less, because they are, but we're still getting some of that money. So it's a real complicated thing, and we are not part of that global cap. Does that answer the question?
It does, though. I think I just need to do some more research because I'm more confused than I was asking it.
What they've been saying is that the cap is a restriction that you don't want. You know, like that's what the state's, I'll call it party line. But we're not so sure. So it's not something that we're trying to pursue this year. And I've got to look at Gustavo's bill again because I can't remember exactly what's in there. I know it's out and about and that they're making a splash with it again. But I haven't had the chance to reread it this year. So I'd want to look at the specifics one more time. Currently, it doesn't affect us.
Okay, yeah, I wasn't sure exactly how it would, and I was hoping for, so I appreciate the clarification.
Okay, but I got to look at that, Matt. I'm glad you brought it up. I'm going to write myself a note.
Well, we gave you more work, Winnie.
Not this week, but yeah, next week. All right.
Not next week, the week after.
Yeah, exactly, Joyce. That's right.
I agreed on that one because this week I already know I'm busy this week. I'm ready for tomorrow's mass force in Coney Island.
So I'm going to send you the budget paper so that you guys have it for your notes. And
Yes. And your advice also is even if you were upset at the governor, be nice.
Peace
oh,
and
for
love.
sure. Yeah. No,
Right?
there's no help for us in turning him against us.
Right,
Yes,
definitely.
Yeah.
And we just need to also just prove to and show the legislators why we need these services.
There is one more thing, Winnie. We also did forget. There is a new chair on a committee. Assemblywoman Matilda is now on the. She's now the chair of
Subcommittee for Minority Mental Health.
Oh, great.
Which will be a big help because
especially
I get we've gotten calls, emails, the parents are so stressed out about dealing with their child with a developmental disability, especially in low income areas. So I did bring that up. She said, yes, she'll be working on that too. And we also have Roxanne Persad on the HRA committee in our social services, which is a big help because we have our champion there for social services, because that's where we get a lot of our funding. We need the help.
And it's funny, Matilda's representative, Jenny, does attend this meeting, and I don't know if she came on today, but she's been a really big help also. So we do have, I think you are correct, Winnie. We do have
a lot of help now.
A lot of help and a lot of more strength. The only area that we have to really work on is the city elected officials.
And we need to educate them because there is an election coming up.
Yes. And at least, and adding that, since you just mentioned, at least we have something new also in election. We have now a new accessibility coordinator and she's actually, her name is Ariel, And yes, his funny thing is her husband's named Eric. So it's like Disney Little Mermaid, which she said it. She said it on this video, so I can actually say it. But she's been a very big help with the accessibility acetate ballot. Now you can print it out on the computer, and you can just color it, and then you can bring it to any poll site where the box is, put it in, you're done.
That's huge.
That's a really big help. So we could continue advocating stuff and getting some completion.
Fantastic. Thank you. I wrote it down about Matilde Frontis on the subcommittee for minority mental health. Thank you for that, guys.
And also, we need to thank the Mayor's Office of Persons with Disability, Victor Khaleesi, but his outreach coordinator, Jonathan Novak, who's been very, very helpful and pushing to make sure that we get the help and funding we need. He helps getting our families the 311 New York City food, or connecting us to the different food pantries. So he's been a wonderful help.
And giving out these kind of nice
And
masks.
also, if families need the clear plastic shield because their child can't handle the mask on their face, they do have links to help.
Great.
We just got to look like this shirt on me. New York
Yeah, it's a
Cup.
great shirt.
Yeah.
So guys, I got to run to lobby days, but it's been great. Does anybody have maybe one last question if there's time for one?
Going once, going twice. Winnie, thank you.
Thank you
so
for everything. Appreciate it. Thank you.
much.
My pleasure, guys. Have a
Thank
great
you,
day,
Winnie.
everybody.
You
Thank
too.
you.
Take
Take
care.
care.
Stay well.
Well, Joyce, we'll now move on to if Eileen got her system fixed. Eileen Sacco from representing the Brooklyn DDRO, aka OPWDD. Is she online or she's still? She said she was on the phone with someone in emergency, so I'm thinking we'll try to get her back a little later. Okay, guys. Guys,
Lori, mute.
guys,
Until now, you had to work with only one hand.
give me one
Now
second,
you're gonna play
folks.
with three.
Guys, mute please, and please not touch any of the mute buttons. Thank you. As I was trying to focus, George, you still with me? Guys? Okay,
Thank God.
that interfered a little. I'll try. Debbie will try to reach Eileen, see if we can get her back on and find out what happened. Guys, Joyce, someone say something because no one's moving.
Okay, don't worry.
Okay, I'm gonna. Yeah, I'm
All right, Chris, what's next?
yeah, that's what I was. Is Gavin in? He's been bugging me to put this in.
I didn't see him in the attendance.
Well, guess what? Then guess what time it is, Joyce? It's we'll start with as we agreed, we'll start with Debbie. But before we do that, okay, Joyce, you can see me, correct? 'Cause I know-
Yes?
okay, I'm not frozen up. Okay.
No.
No, because they are doing work in our area.
No, I had to make sure. Okay.
Okay.
No, I could see you perfectly.
Okay, just making sure. Deborah will do her report quickly, and then Joyce, you do your special surprises.
Okay, good morning, everyone. As I said before, we do have some, Winnie, and you heard myself say, individuals who live at home can now get the COVID vaccine as well as their families. Also, want everybody to know about that Crystal explained about getting masks. You also heard me saying that if you need help getting a face shield, you come to our website and you go on to the Mayor's Office of Persons with Disability, known as MOPED, and they will actually take and help you get those face shields for free. Also, as I said, I know it's been very hard for the families at home when you have to do the day hab over this video, but we are working very, very hard to see that you're getting the help and services. We will try to see that we advocate to see that everybody gets broadband, and so that you can connect with everyone. As I said, I'm going to also thank Joyce, because I like the fact we can work together to do our joint meeting. So that's all I have to say. If anybody has questions, I will try by the answer. If not, I'm going to turn it over to now Joyce Levin, Chairperson of the Brooklyn DD Council.
Thank you, Debbie. Thank you very much.
You're welcome.
I'd like to, hopefully everybody got the invitation to the 5 Borough Legislative Breakfast and was able to register for it. You have to register through Eventbrite. There is a link on the invitation that Chris sent out. The breakfast will be on Friday, March 5th from 10 to 12. And it is the 5 boroughs, so each borough has a very limited amount of time to present the different topics. We're presenting Brooklyn and the Bronx are co-presenting on EI and clinical services. And then the other boroughs, there'll be a presentation on residential day services and education. And we're very lucky to have Chris Treba come speak at the breakfast. Representing Brooklyn, we were able to get 2 representatives that will speak live at the breakfast, and that's Roxanne Prasad, and we're very grateful to have her, and Andrew Ganardis, and we're very grateful to have him, and they'll both be on in support of the efforts, and we know that they are supportive back in the legislature, and very grateful for that, because we need all the support that we can get, so we don't face those massive cuts that Winnie was discussing. And in some cases, that will be the end of certain services, because agencies just cannot absorb the cuts and be asked to go 10 years without a COLA. The price of bread goes up. Everything goes up. But our ability to receive the funding for that has not gone up, and people can't sustain that. So we hope that there will be some positive news coming out of the legislature for us. So I encourage everybody to join us at the citywide legislative virtual event on March 5th. And I want to give a big shout out to Chris and Matthew, who helped do the link and do the Eventbrite setup, and thank you very much to them. So, any questions?
Joyce, just to add one thing, just to let everyone know that the email with yes was sent out twice. It's also available also on our website, and if you see the bottom here that says our website /special events, it's actually in the special events. Also, you can register very quickly and also right onto your cell phone. So it is easy to do it. If you have any questions, as Joyce said, please let us know from now till the end. Joyce, we also have Eileen Sacco now on. I'm going to switch it around.
Great, no problem.
Yeah.
Thank you.
I'm going to switch now.
I think I figured out how to, can you hear me now?
Yes,
Loud
we can.
and clear.
Yes, we can. Thank you.
Give me 1 second, because I am just putting you.
There she is.
And look.
Okay, there we go. I figured it out that I had to dial pound 46. I was just clicking and it wasn't working, so I apologize, everybody. I'm still in 1980s when it comes to tech, so so I apologize. But I do want to thank everyone for both hosting the meeting and participating in the meeting. All of you guys do a amazing job at what you do. You know, I'm sitting here and listening, and you know, I heard Deborah talk about, you know, some of the things from my office, from OPWDD, and I was like amazed how proficient you are in OPWDD lingo. So kudos to you.
Thank you.
So, like, I feel like I'm gonna, you know, come out of the hallway one day and just see you there performing some sort of service. So thank you for what you do, and again, all of you. I know this has been a tough time. I don't think any of us thought that, you know, almost a year later, we'd still be, you know, in the position that we all are, you know, due to COVID. It's been a trying time for everybody, you know, financially, emotionally. It's, you know, who would have thought, you know, I mean, you know, when we first closed down, we all thought it was going to be a couple of weeks, never a year. So, you know, we've, you know, I think we can all say that we've made it through the rain. You know, there's, you know, there's still some showers out there, but, you know, with the vaccine and, you know, with all the, you know, tech that we're all using, even though I didn't do such a great job today, we, you know, we're doing better than anyone would have expected a year ago. You know, everything in OPWDD is up and running. You know, everybody is working. And, you know, as you know, there's some changes on the way, with some of the services, and that's going to be in the next couple of months. But, you know, we're here. Some of our roles are going to be changing. We're looking, we've been working over the last year to start changing some of the services, instead of being borough-wide, being city-wide, or, you know, the people who'll be doing it will be the same, but the management will be citywide, so there'll be uniformity with how services are, you know, are done. Because I know sometimes you can go to one borough or another borough, and there's little tweaks in the system is how, you know, agencies have to do things. So we're working on making all the services and all the parts of OPWDD, you know, there'll be different people running different units. So that should be good for the agencies too, because there'll be one person, you know, you have to talk to instead of 5. So, you know, little by little, we're going to be doing that. And, you know, from the Brooklyn end, where we are moving, it looks like it's been a little bit delayed. Actually, a couple of people went to the new office one day last week for a quick, you know, tour of it, and I heard it was beautiful. I saw a couple of pictures. It looks that it's like it's very nice, and you know, hopefully when COVID's over, people can come visit, because right now there's no, you know, we're not in there yet, but regardless, there's no visitors. But I've heard that it's a beautiful space, and I think, you know, now we're targeted for possibly April. So we'll see. I guess at the next meeting we can report. And I know a lot of people have, a couple of people have registered for the legislative breakfast from Brooklyn. I'm actually going to do that today. So, and again, kudos for you guys to, for putting that together. And, if there's any questions, the best way to reach me is by email. And I'll let everybody know what that is. It's ilene.sacco@opwdd.ny.gov. Right now, all of the units in Brooklyn are, except for eligibility and front door, but I can always, reach over and ask, for help with those. But all the other units are under me. I'm second under Lucy. So if anybody has any questions, shoot me an email, and I'll see where I can help. I'll do whatever I can to help. And again, I just want to thank you all for what you do, and and putting this together today and always.
Eileen, this is Chris. I just put it on the chat, your email account, your email address.
Okay. So yeah, apparently I also had I'm having, it's just one of those days. Maybe I should have stayed in bed, but I also see that I typed in my own last name wrong. So on the screen it says Saki, but that's supposed to be an O, and I don't know how to change it. So
It's okay.
I mean, I know a lot of you for a long time, so
Yes.
you know, it's Sacco, but yeah, apparently it's just one of those when it rains it pours days. So I apologize.
Eileen, just look at my face when I do this. Oh, your last name. You just said. So I'm just saying that because we're on a meeting, so I'm being nice.
Thank you.
Yes, and Eileen, please check your email too when you get a chance. There is a question that it was brought up, Eileen. You just muted yourself.
We're keeping you. We don't
Hold
want
on.
Unmute. Okay, I'm going to go into my email right
No,
now.
Stay. You're fine.
Stay where you. Don't touch the mute button
Don't
yet.
touch anything yet. Okay.
Let me just say this, Eileen. We have gotten emails from both ends. Everybody's been asking, do you have an update about the family support guidebook? And I am not saying.
No, but I can get that for you today. That's an easy one. I can follow up with Angela today. So I know that doesn't that usually come out in the fall? I'm assuming. I guess doesn't that usually come out like October-ish?
Well, technically, this is the story, and I'll do a quick story. When we used to have the family support fair in the springtime, that's when the guidebooks were ready. But remember that 1 year we moved the fair from the spring to the fall. So technically, we never seen a 2020 guidebook. So there's been no guidebooks
Because of COVID too.
Because of COVID. So
okay.
Right now, and as I'm going to say to everyone, there is no family support guidebook on our website because that's an older version, and I can't keep older versions after a certain time.
And we also need the agencies who are here and listening, please update your information and send it to Angela Blake so we can have eventually a Brooklyn Family Support Services guidebook on the website. We can't right now because we don't have, she needs the updated information of who
Sure.
programs, what.
I will reach out. I will reach out today, and Chris and Deborah, I'll shoot you guys an email as per the status. And you know what? I moved from Beaver Street to Brooklyn in 2019, and that was the year that it was in the fall. So in my mind, it was in the fall. That was the first one I went to in last year. So that's on me. Apparently everything is on me today. But I will follow up today and find out what the status and where we are on doing that and get that moving.
Joyce, do you have anything you want to say?
Just to let you know, Eileen, we're planning a transition fair for the kids that are aging out of school, a virtual transition fair sometime the end of April. So that might be too soon for the guidebook to be ready, but I know that we've discussed that in planning for the meeting. That would be very helpful.
Okay. We actually it's been almost impossible to get new staff, with hiring freezes in the state because of budget money, but we were very lucky to get a new transition coordinator in Brooklyn. Like we were able to get that in under the wire. So kudos to Lucy on that. His name is Sam Young. And right now, actually, we haven't had an official transition coordinator for a while. Our waiver person was doing it for the last, I'm going to say 6 months, and she's now training him. So that would be, if you can get us the information on that when you come with the date, that would be great for everybody to meet him too, because he's new.
Absolutely. Do you have contact information for him? Because Mary Christopher might, but I'm not sure. This way we could bring him in on the planning of the fair.
I will get that for you because I don't believe, he literally started like a week ago. things don't move that quickly as far as we're getting him access to, all of the, tabs and choices and stuff like that. And I will get you his information, but that would be very, very, I think that would be a wonderful way, for him to meet everybody and everybody to meet him. So I'm actually excited about that. So thank you for letting me know. And so I'm just making sure I'm going to get back to Chris about the guide and Joyce is going to get back to you about.
And also Eileen, I like to have that information because if that's someone new, I need to make sure I update that on the new update page.
For the web.
Okay.
OPWDD.
And also he's kind of familiar. Do we know him from somewhere? Because you just sent person's.
He did some stuff with OPWDD. So, but he's relatively new to the system. But he did I was actually one of the people who helped interview for the position, and he really did an amazing job knocking it out of the park. So we're very excited about him starting with us. And with everybody, with everything, there's a learning curve. But from what I'm hearing, because I'm working on the transition for the person who's been filling in to come back, I'm hearing he's doing really good. So,
because he sounds familiar. That's why my finger is going like, why do I know him?
Yeah, he sounds familiar. But you know what? We'll meet with him. We're all going to be there to help him, and he'll help us. So it's a mutual festival sharing. So,
great. Thank you.
You're welcome. Thank you. That's good news that we have a new transition coordinator.
1 second, Eileen, before you do leave, there was a question from a parent, and I'm going to see if she's here. Audrey Peterson, do you have a question? You're on mute. Go off mute. Audrey, you can speak. Anyone's on the phone, you can *6 yourself.
Yes, hello, Chris?
Yeah.
Yes, hello, Chris?
Yeah, we hear you.
Oh, yes. I wanted to know, do we still complete the surveys from the agencies? Are we still supposed to send those in?
Why
Even
not?
though we're not present at the agencies?
For what services, my dear, that you're getting?
I get I got a survey from an agency that he hasn't been respite. The respite person hasn't been coming, but I did get a survey. I didn't know whether to send that back.
Eileen, what do you think? Should she send it back? Fill it out?
As far as I know, isn't everything the same? It's just we're doing stuff
virtual, yeah.
Virtually.
So
none of the rules have changed.
Okay. I just wanted to know. Okay.
I mean, I don't believe you have to send it hard copy. You could, definitely, scan it and send it over.
No, I didn't know whether to send it, even though the rest of the person would come, to the home.
Sure.
Now that everything's virtual, I didn't know whether to still send that back, even though the rest of the person's not coming.
Yeah, but it still gives a good look into, how the program's going,
Okay.
So,
Okay,
yeah.
I'll still send it. All right. Thank you. All right, you're welcome.
Audrey.
Thank you.
Yes,
All right,
Debbie
you're
saying
welcome.
thank you.
Thank you.
You're welcome.
Audrey, just to remind everyone who is on the phone as well, just to remind everyone, is *9 is to raise your hand. So if you're on the phone, if you have a question, please do not have to hang up and disconnect yourself. It's *9 to raise your hand, *6 to unmute. So it's like, Eileen, since you're on both ends, which is a updated new system you just did, phone and camera, since you're on the phone, you can always mute your phone.
If you want to.
Yeah.
You know what? I unmuted it, though, and it didn't work until I hit the #46. Because earlier on, when you had called on me, I was screaming into the phone, I'm here. And I had unmuted the phone, but I didn't do the #46. So apparently I have to do both. But now I know for next time, but I was literally, I'm here.
I'll have to show you another time how to do magic tricks.
Yes, yes. The computer, he's the genius, and I'm the one with DV on the computer. I have no problem saying that, Eileen.
Yeah.
I'm gonna leave in a few minutes because I have another meeting.
Yes.
But yeah, as you said, please, feel free to post my email. I read it. I'll it's ilene.sacco@opwdd.ny.gov. Ignore how my name is spelled here because
No, I have it.
I'm having issues
correct.
today.
It's okay.
Watch
It's
this.
okay. Watch.
See?
All right, and enjoy the rest of. Thank you, and enjoy the rest of the meeting.
We appreciate it. Thank you.
Thank you. We'll see you soon.
See you soon, Eileen. Stay well.
Yeah, you did. Okay, Joyce, since you guys did your subcommittee reports, I'm gonna move on.
Didn't know the chair report.
Yeah, chair report. Now we're up to subcommittee reports. Had a little flavor moment time, so I just had a little flavor I'd like to put in. Okay. Yes, it's time for the subcommittee reports. Since we're gonna follow the dates, is Children's Committee Chair, I know Teresa is not here, but I'll make it very easy and quick because I know Rose, you're still there with me? Oh, hold on. Rose?
I'm still here.
Okay, stand by.
Okay.
Let me just do this quick. As you see, folks, the next Children's Committee meeting is March 9th. Let me say the information first because the report's very easy because the speaker's right next to me as well. March 9th, 9:45, and our speaker will be Ruth. Ruth will be discussing.
She's from the Include NYC. She will be discussing how to handle remote learning with a child who has an IEP.
And other stuff as well.
And other stuff too. Also, the previous meeting, we were discussing issues that were affecting and are affecting the early intervention preschool, the private schools, as well as our kids in regular grades from 5 to high school. So we did discuss that issue. The next meeting again will be
March 9th. Please, everyone, try to get on early so we can try to start the meeting on schedule for that committee. So therefore, they can, because this topic is very seriously as well.
Very important to know.
Yeah.
And Teresa Del Piero from AHRC, she's the principal, but also chair. We have her information listed right now, but it's also on the website.
Yes.
All right.
Now, moving on to Rose.
You ready?
Rose, why are you hiding from me?
Hi, Rose.
Hi. I'm not hiding. I'm here.
I like to see the face. Especially this is your thing. Go ahead.
It is?
Yeah, it's your care coordination.
Am I still care coordination? All right, everyone. So we had our meeting in January and we discussed HRA. That went very well. We had a good turnout. We are planning for our next meeting for March 10th. And it's going to be more of an open conversation, kind of like what Winnie was talking about and what Deborah touched on, the vaccine. So we really want to start hearing from our family members and educate them. So we would like to know how the CCOs, because I know a lot of them are reaching out to family members and keeping track of how many clients who live at home who are not getting vaccinated. And I think it's really time for us to, educate our family because there's still the fear of trust of this vaccine out there, right? So we want to get a good idea, a good sense of what's going on with family member, how are they feeling, are our individual getting vaccinated. We're about to hit the summer. Some programs are reopening to bring, individual back on site. What is that going to be like? So just kind of more of an open conversation with the CCOs and get some feedback on the surveying of individual being vaccinated. So that will be our next conversation for March 10th.
And as a reminder, everyone, yes, it'll be on Ring Central. Please make sure you see this link. Meetings, Rinks, you don't have to write meetings, but always put in ringcentral.com/join, and it does come in and it will ask you for the meeting ID number, which is right here. If you're doing the phone, make sure you get the number, then the ID number.
Add one thing, Rose, and Rose and I, we want, any parents we have online right now, please ask your care coordinator to actually come to this meeting. It is very important, and you also come to the meeting too. because
Before Rose cries.
because we want to make sure that this committee works together as parents with the clear coordination so that we can make the system stronger and better for our families. Thank you, Rose.
Before
Thank you,
Rose
Deborah.
leaves, does anyone have a question for Rose? Okay. Nope. Joyce, you still with us?
I'm here.
Joyce, can you please mention the transition fair coming up, and I'll help you with the meeting date?
The transition fair, we don't have it'll be sometime the end of April. We don't have an exact date yet. We're still working on that. You know, and trying to plan how this is going to, how it's going to work out, because it's virtual, so it's a little different. So we're still planning it, but hopefully we'll have more information being sent out in March.
Yes, and the next transition meeting is due to the fact that this month they did not meet because it's school vacation, but the next meeting is March 18th. They are using Zoom, so you please contact Mary Christopher or the new co-chair, Joy Palmer. Reach one of them, and then they will make sure you get the meeting ID number. So please, everyone, try to attend some of these subcommittees, and that's including our parents. Now I'm gonna get Joyce. You're gonna laugh too on this because I'm gonna make everyone laugh. This is my outreach update that's gonna be very funny and make everyone feel a little happy. Let's get some toughness in New York, and why I put that up for a reason. Why I'm putting that up for a reason, saying let's get tough, because you know what? We need to get a little tough. As I mentioned this earlier so many times, please everyone, please go on to our website on what you see in the bottom here, right here in the bottom. Please visit our website /update/out/outreach. Automatically, you can still go on the main website and you'll see a video. Click on it, watch it, enjoy it. This will help everyone. And I encourage everyone to please watch that video. Some of you who did attend yesterday, I thank you so much. Didn't have to worry about a lot of people because I can stand everyone's busy. But this was something that will help us and maybe change some things in now and to the future. Now, I do have some breaking good news, because some of you have been asking me this since day one. Instead of having 12 elevators, we are now, because due to the coronavirus, we are behind schedule because of that. There will be 16 elevators that will be added in for this year's construction. Due to the fact that last year was supposed to start 2020. This year it's combined 2020 and 2021. More stations will be added in as the month or the year comes in. And that's part of South Brooklyn, Staten Island, other areas where they need it. But as you know, we have to make sure we start a certain amount. As you see here in Brooklyn, 7th Avenue on the F and G, Loma on the L, Metropolitan/Grand Street, which I'm going to say it's both Metropolitan and Loma because I got this from the MTA website. Not website, from the chair of TRC. So he always mixes them up. Beach 6-7 in Queens, Dyker. You'll see all these names. Now there is one station that is being worked on as we speak. Junior Street/Livonia. That's I said Junior. And Livonia Avenue on the 3 and L train, which they are doing as we speak. So please be alert. That will be soon a real free transfer. So therefore, it will be more ADA accessible and it will be easier to connect. So say like, instead you have to suffer in the B17 bus, you can take the L to the 3 train and you can get on a decent train. So be on the alert. There is much more coming in. And the good news is we don't have to worry about the budget on the MTA. Fare hike is not going up at this time. The 30-day pass will remain. But I'm sorry to have to say the bridges, yes, will go up a little bit. So I'm going to move on to the next page, which I'm so glad Joyce is showing. Joyce is going to love this piece. First, I want to thank Joyce also who attended. A lot of people did attend to the grand opening of our website. Our website, which you see this picture here, is our cell phone mode here picture. So if you're using your cell phone, please visit the website. As Joyce mentioned earlier, you can register online on the website, on our website. You can register for the citywide Legislative. It's very hard to say words, but you can RSVP there as well. And I will say this, yes, the celebration did go well. I'd like to thank everyone who did attend. If I mentioned every name, we'll be here till next year. So let me just get on to here, this page. On our website, we have a lot of more information that we ever did. We have the trainings, the events, like the subcommittee report, subcommittees are there. The DD Council as well as the joint. We have a lot of information about Corona-19. And if I say everything, will be here till next year. So I'll remind everyone, please visit the website. It is up to date. It has a beautiful, it's a little more colorful, a little more easier to get on your phone and your tablets. So please, everyone, make sure you visit the website. And as Joyce will agree with me,
It looks great, Chris.
yes, that's just the screen there. But you know, you saw it on the website, it was really good.
Yes.
But make sure everyone please RSVP for the citywide event. And any events that are coming up, or if you have a service opening, please email it to us. Yes, you can put it on chat now, but email it. I would go faster and much quicker. Now, as we mentioned Board of Elections, and this is the lady, and I think I took her name away, but it's okay. No, I don't. I have it right here. Ariel
Merkel.
Is the 88 coordinator. Please, everyone, you know this year is city official elections, city like our mayor, borough president, city councils, or some of the
New York City controller, the public advocate.
Yeah, I said city. Please, everyone, visit the website, sign up. If you're having a problem with the website, you have a complaint, please contact, and if it's an ADA issue, please contact her or call or email her at americ@boe.ny. And she does get back to you as soon as possible. I have to say, the new ballots are very easy and you don't have to stress yourselves. So please make sure you all register to vote. You don't have to show up there. You could do it in the mail. Now, before I move on, does anyone have any questions for me before I move on to if there's any elected officials or announcements? Joyce, you have any questions?
No, Chris.
You know, I got to double check.
I don't either.
Yeah, we already know that. Does anyone else have any questions? And I'm going to double check with the phone.
Okay.
Does anyone on the phone have any questions for me? Okay. Then I'm going to move on now to since we are moving really, really well. Is there any elected official representatives here today you want to say anything they want to say? Once, twice. Okay. Now, Joyce, we're up to announcements. If anyone has an announcement, please raise your hand. And I remind everyone, yes, you can type it on the chat and email us. So let me just, okay, our first panel, let me see. Sandy, go ahead.
Sandy Nape, are you there?
I don't know. Sandy? Okay.
Hi, good morning, everybody.
Hi, morning.
Go ahead, Sandy.
This is Sandy
Hi,
Naper from the
Sandy.
Gap Community Network. And I just want to let you know, we're having a free workshop on March 3rd. It's called Strategies for Learning Success During the Pandemic. And it's going to be given by the noted occupational therapist and author, Lindsay Beal. And it will be from 10 a.m. to 11:30 a.m. And to register, please call 718-436-7979, extension 704, or email familyconnect@adaptcommunitynetwork.org. And also ADAPT is offering family reimbursement in all 5 boroughs. We also offer home modification services. We have day
Sandy, hold on one second, Sandy. Sandy, hold on. We're getting interrupted, and I got to remind everyone, please do not play with the mute buttons, please. Thank you. Sandy, please continue. I apologize.
Okay, we also have openings in Dayhab. We have residential vacancies. So if you want any further information on that, please email our Project Connect department at projectconnect@adaptcommunitynetwork.org, or please call 877-827-2666, and everything is on the chat. Thanks very much, everyone.
Thank you, Sandy. Dolores, you're next. Doris Khan.
Doris Kahn from New York State Institute on Disability. I just want to mention that we have openings in our crisis management services for families in the Bronx, Brooklyn, and Queens. And you can contact Juliet Hawkins at 917-524-4856. And we also have openings for evaluations, which will be done remotely for the purpose of individuals who want to get OPWD eligibility. And that's for individuals residing in Queens, Brooklyn, Bronx, and Staten Island. Contact Elizabeth Sunshine at 917-699-0578. NYSED also has reimbursement in all 5 boroughs, and you would contact Jackie Tribodi at 929-202-1115. We also offer transportation services up to 4 trips a year for OPWD eligible individuals and their families for medical appointments or recreation outings, and to call John O'Grady at 917-747-9424. I'm going to email, Chris, I'm going to email you their names and phone numbers.
That's
Send
fine.
it to your email.
That's fine.
The better way.
I agree.
People don't have to run.
Yes.
Thank you, Doris. I appreciate it very much.
Thank you, Doris. We're having a little glitchy system, but I heard you.
I just have a quick question. I didn't get an echo. I did. Her title is at OPWD. Yeah.
One second. I'm having a glitch system. Hold on.
Okay, I hear you.
Okay, no. There's a backbeat. That's why. Go ahead.
Yeah, I didn't get what is Eileen Sacco's title at OPWDD?
She's part of the community service division.
She's the supervisor right under
community service.
I got that, but she's right under Lucio Mezzi.
Oh, okay.
Oh, I got her title right here. I'll give it to you just a second. But we'll move on at the same time also, and I'll answer that question in just a minute. Because I just got her email earlier. Okay. Yeah, I am correct. She is, okay. She is remember you had Janet was community service. Like Lucy, right. She's also, okay. Because Lucy, she's more like a director of community services. So Eileen is equal to her, you can say. She's community service supervisor on the Brooklyn DDRO. And her email's on the chat. I
have her email. I wasn't sure of her title. Okay.
Community services.
Thank you.
Let me move on because I see a lot of hands up. Sammy from the Brooklyn Public Library, you had your hand up. You're next.
Hey guys.
Hi.
I just wanted to let you guys know about a couple upcoming events we've got going on at the library. We've got a special education for young children, 10 questions and answers by Scott Mesh, the co-founder of Los Niños Services, on March 2nd at 4 p.m. We've got a really fun garden program. It's part 2, but it's been a blast about Become a Gardener. It's a virtual program with stories and movement and nature. And the next one's happening on Tuesday, March 2nd at 4:30. On March 3rd, we've got our monthly Navigating Your Child's Disability 1-to-1 with Ruth DeRoma from Include NYC. And on Saturday, March 6th at 2 p.m., we have a Music for Autism concert, which Those are always fun. And then we have another one on March 21st, also at 2 p.m.
Thank you, Sammy. And please send regards to Carrie. We miss her at this meeting, too.
Well, we're glad to have you here too.
But we miss you, too.
We like having you here too. Thank you.
I will pass that along. I know she was looking forward to coming today, but she unfortunately had a scheduling conflict.
Tell her, can you just tell her to
It's
smile,
okay.
please?
It's okay. Thanks.
Will do.
But we tell her it's on video so she can watch it.
Let me just check. GHO, you had your hand up, and I know Rose, you'll be next if you have an announcement.
Hi, everyone. Daisho Choi Kwak from General Human Outreach, GHO.
Yes.
With regards to program announcements, we have openings in employment program, SAM, Pathway, and other programs. They have Without Walls and ComApp and Weekend Respite. And we have family support service coordinations. And we provide, under that service, we provide case management, free evaluation for Queens resident, that for only Queens resident, family reimbursement, Manhattan and Queens, and other services for other boroughs. We have a contract with the CCO, Care Design New York. So we provide intake service enrollment assistance for Korean Chinese speaking families at various levels. Bilingual staff in Chinese Korean are available. You can email Pat at ghoinc.org or call 718-307-6563 and other numbers. I'll post it in the chat room. Also, I emailed to Chris. Thank you.
Thank you.
Thank you. Rose, you're next, and then Joyce will be doing her announcement for the next meeting. Quickly. Rose? Okay, Joyce, Joyce, you there?
I'm here.
Okay. Joyce, can you please mention the next meeting date before we continue other announcements?
Yes, the next meeting date will be March 24th. And then on the fourth Wednesday of every month through until June. And then we'll see what'll happen. But March 24th is the next meeting date.
Yeah.
See everybody March 5th. And hopefully by the 24th, we'll have the information on the transition fair in April. Okay. I'm going to have to go in a few minutes, but thank you, Chris, very much for setting everything up and hosting.
Thank you.
And thank you, Joyce, for co-hosting also with me, the chair of my council. I'm glad we've been able to work together, do it together.
No problem. Thanks.
Thank you. I see Rose had to run. Okay. I saw GHO spoke. Let's just make sure. Let me see. Who is 347-828-6660? Please identify yourself. I'm unmuting you.
Hey, good morning. This is Pat. Hi, Chris.
Oh, hi, Pat. Were you hiding too over there? Now I can say it to both of you.
Cell phone.
Yeah.
Oh, you're on the cell phone, Pat.
Yeah.
Okay, go ahead.
Yes, hi.
Yes. Happy New Year to both of you guys.
Yes, we wish everyone.
Yes, Happy New Year. Thank you.
Asian
Thank you.
New Year. Happy New Year.
Yeah.
Yeah. Yes. Thank you for the opportunity. I just want to highlight that GHO, the employment program and Day Ahead Without Work program we have immediate opening. So please, if anyone is interested or who is aging out, please contact us and visit our website. And also want to highlight our family support service coordination service. That's the service that we will help the family who is seeking OPWDD service or is new to the system, would like to get more comprehensive understanding about the system and the service. and what's available there, and hopefully get them, I mean, in a short time to get them into a CC1 of CCO that they wish to join. So thank you very much. This is Pat Lu from GHO. Any question, you can call me 718-307-6563. Thank you.
Thank you, Pat.
And go ahead, Fat
Thank
Choi.
Go to Fatai.
Thank you.
Thank you.
Shay.
Or
Doje.
Doche, sorry. Okay. Oh, Rebecca, YAI, because I know Matthew's busy today. You have anything you want to announce? Ooh, there we go. We're playing mute buttons. Rebecca, you're going to have to unmute yourself because you just locked me out.
Can you hear me? Hi.
Yes, we can.
Hi.
Hi, how are you?
Good.
Good. Yeah, Matt had said he sent you some of the updates. Did you get it?
Yes, I do. But
Okay.
just since you're on here now, I'm just saying, do you want to say anything?
Yeah, I can. You know what? We have, we do still have lots of availability for our free evaluations in Brooklyn. We also have family reimbursement and emergency respite reimbursement in Brooklyn. And I think those are the main openings that we have right now.
Thank you, Rebecca. But Rebecca, can you, I just wanted to thank one thing. I have to say, you know, Matthew is, I have to say, and I think Pat will agree with me also, Matthew is a really good, a good representative outreach person.
That's good. I will pass that along to him.
Yes, and well, can you make sure his boss gets that too? Because, you know,
I will.
And I'm just going to say this. I do want to thank a lot of agencies, and I will say this, you know, it's nice to see information is still going out and helping families this time in need. And this is something I'm saying, Matthew is one, thank you, but every agency today, I want to thank you as an individual. I'm saying as an individual, thank you. Thank God we live in New York, because if we go to another state, it's much more worse than anything. And we are working together, and we're dealing with this issue at this time of need. So I wanted to thank you, and please let Matthew know. I'll see him
I
tomorrow.
absolutely will. Yes, and that's nice of you to say. I'll pass the information along to him and Caroline.
Yes, Caroline, I have to say, she's fun too.
I'll let her know that.
Yeah. But thank you so much.
You're welcome.
Let me just make sure. Did I miss anyone? Okay, since no one else has any other announcements.
I actually have an announcement to backtrack on Rebecca.
Hello.
Hello.
Nice to see your face.
My name is Destiny. I'm one of the supervisors for Community and Family Services at YAI. And I just wanted to let everyone know that we are open for referrals for behavior management services in Manhattan, Brooklyn, and Queens, and Bronx.
I was going to say, we gotta have to have something in the Bronx.
Yes. So all 4 boroughs we are open for.
But I do want to welcome you ladies. And you know our meetings are very easy to visit our website, and it's been updated. And as I remind everyone. But I wanted to thank you guys very much. Let me just check. See, I'm myself.
Yeah.
Let me just check. Does anyone else? Then I'm going to move on to the next part, which is the reminder announcements. And Deborah will have one in just a second. Yeah, Deborah, you're going to mention this?
Yes, first of all, I want everyone, yes, you've heard it, and I'm going to repeat this again. The 5-borough DD Council legislative event, which is technically our breakfast, bring your own coffee, some of the boroughs said, will be on Friday, March 5th, from 10 a.m. to 12 p.m. You can register now. You have the link is HTTP. Well, I'm not going to say all of it.
It's right there.
It's right there on the screen.
Or visit our
Or you
website.
visit the Brooklyn Families, the BFSS website, and there is the link so you can register. Please register early and now so we have your name in. So on the day when we have to sign you all in, we will be able to get you on. Please also, you probably need them to also get on by 9:45 so we can get as many people in, because we'd like to start the event on time at 10 a.m.
And end at 12.
And end at 12. It is 5 boroughs. The advisory councils are working with the DD council in their borough. They're supporting. This is a DD council event. The advisory councils do not have any say or not have any say about the speakers, but but our input was heard. So I just want everyone to be aware of it. And it was mentioned many times. And at each of the subcommittees, it will be announced.
Well,
unless it's-
actually, none.
well, none of them now, because guess what? The next thing will be
The legislative.
legislative event. So please, thank you, everyone.
And I remind everyone, as Deborah mentioned, the website. Please visit the website. Now, if you have an announcements or events or training, please email us. It is not that hard, and you can send it me as a PDF because I will put it in as a PDF as an attachment. Please make sure that if you're going to type it in, please make sure you type it in. I copy and I paste it. And that's the information that will be on. So please make sure. And always very important, visit the website at www.bfssac.com. And now I have the date now in front of me. As a reminder, the next joint meeting will be March 24th. We, as Rose mentioned with the CCO, we might have a speaker talking about the Corona-19 vaccine. So, because vaccines are very important, some people are worried about allergic actions or much other things. We will have some information regarding A, the ingredients, B, other stuff. If we mention everything, I'll be here until tomorrow. So please, everyone, make sure you do attend the next meeting. The email will be going out once we get everything else out. And I remind everyone, please make sure that you're on the email. Please email. You don't have to worry about, saying, am I on the list? You can look on the website. You can look on you send me an email, you'll see what the next meeting dates are also available. The information will also be available on the website, like this recording will be on the website by the end of this week. So please make sure that in case you missed something, you can watch it again on this. Since no one else has any questions before I adjourn, does anyone else have any questions?
Okay.
Doris, do you have a question? Because you look like you're thinking.
No, she don't.
No, I'm just joking. She knows I'm just joking because she looks like.
By the way, I want to wish everybody in the Jewish community celebrating Purim. Happy Purim.
And think of sweetness and beautiful leaves and the beautiful weather.
And think of all the nice candy you can get for Purim.
Yes. So everyone, please enjoy your day. Enjoy the sun and weather. Get some fresh air. But always remember, everyone, please wear a mask.
Or a face shield if you're not able to wear it.
Okay. So I am going to say to everyone, meeting
adjourned at 11:47 a.m. Thank you.
Thank
Bye,
you.
everybody.
Bye, everyone.